698.
1,698.
698. 98.
98. Dear friends, I am so happy to see you this Saturday because this Saturday is a special day for us. We have treated 1,690 cases of puberphonia. So within this week or this month, we'll be in 1,700 cases of puberphonia treatment. Definitely, we are getting regularly patient for treating puberphonia as the success rate is so high. Every people, we want to treat not only the boys, this is changing the life of the patient. I am so happy that we have published our work in many journals. One of the journal is an international journal, a journal of emerging technologies and innovative research. Here I have published my work in a special manner because this should be referred by all ENT doctors. How we are getting so much of puberphonia boys with, this is because our work is regularly published in YouTube channel and other media channels. Because now the age of media. Here I want to suggest my findings to you. Puberphonia boys means boys when they become matured age, around 14 to 16th year, their voice break. High pitch voice will change into low pitch, a manly voice. So that is the thing prominent in puberphonia. But this voice can have 100 differences. It need not be purely female voice. This is what I want to emphasize, and I have published this in the International Research Journal. The voice of puberphonia, there are 100 varieties are there, but I have formulated 10 varieties. How this voice present to a doctor, how these boys are recognized in the society, how the boy react with the voice in the society, other people how they perceive, what they will tell a doctor or the society, how is my voice. There are 10 common voice character they will tell. Number one, their friends will tell, your voice is inaudible. Try to note it clearly. Puberphonia boys won't have always female type of voice. The first symptom they will tell is, they will be calm. They never want to exhibit their voice to the public. So they talk slowly. The more the recognized voice is inaudible voice. They talk slowly because other people will recognize them. as puberphonia. They never want. So second point is vocal fatigue. They won't able to talk continuously. Fatigue. That is the second point. Try to note. The third thing, they will have a child voice. Friends, parents, teachers, everybody will recognize this boy is having the child voice only. They continue to talk only in a child voice tone. The voice is not mature, that's all. So it may take some more years to become mature. Don't worry. So if it is gone beyond 25 years of age, what will happen to the boy? That is the thing. So the third point, the first point is inaudible sound. Second is vocal fatigue. Third thing is they will have child voice. Then fourth one only the lady's voice. As the high pitch continue, their snack and recognizable voice is a lady voice. Even some family, the adult male, they'll talk like a lady. Your voice is similar to your wife. In the phone call, they may mistake whether Mr. is calling on the other side, responding to the other side, or Mrs. is responding. They will have the doubt. So purely they will have the lady voice. The fifth one is some people in Puberphonia have double voice. So they are having the manly voice, but without their knowledge. When the emotion change, the character change, the situation change, according to their mood, it can be a double voice. So that is recognized by their relatives, friends, and other things. Puberphonia boys can have a double voice. Then another type is only nasal voice. They are talking with their nose as a predominant resonating place. Friends will recognize these boys only talking in the nasal tone. That is also a character voice of Puberphonia, nasal voice. The seventh one is this boy is not having a strong manly voice, not a strong voice, very feeble voice. He is not recognized as a female voice or child voice, but recognized as having a feeble voice, slow voice, or melody voice. This is noted more prominently on singers. So their voice is very slow and not having a strong voice. Then another thing is high pitch voice. This is most common in singers because singers used to sing from the younger days itself. They continue to use their high pitch voice. They feel that is the more melody. That voice is more appreciated by the society. So they continue to use that melody voice, and always their voice will be high pitch voice. Even we used to call people high pitch Ramasamy, high pitch Kandasamy, high pitch Aravindan. So we used to differentiate. If two are having the same name, we used to tell that boy is a high pitch boy. So that is what differentiate. Then the next ninth point is they are having hoarse voice. Hoarse means rough voice because these boys try to change their voice by so many methods they recognize. They want to make it more manly and strong. So they try to change by themselves. And lastly, what will happen? The voice will become rough and hoarse. They cannot continue for a long time. And this voice cannot be recognized by others. So this hoarse voice also we are thinking in terms of puberphonia. And the last one is breathy voice. So just like breathe, the sound is not strong. Only breathing is coming. When the boy is talking, when the adult male is talking, instead of sound, the breath only produce some sort of sound. All these things, these 10 things, we are bringing in terms of puberphonia because all the structure of the phonatory apparatus should be normal, but the voice is changed. Try to understand. A patient is having hoarse voice with a normal vocal cord, normal structure. We are thinking in terms of puberphonia and treating, we are giving good success. If your hoarseness is there, try to understand. It can be due to teacher's problem, vocal nodule, old age problem, cancer, paralysis, tumor, polyp, cyst, keratosis. All this can produce hoarseness, but we are bringing it in terms of puberphonia because the vocal cord structure is normal. It is not cancer, it is not polyp, no keratosis, no vocal nodule, no presbyo, old age problem, or teacher's nodule, or Singate's problem. Whole structure is normal. Then you are diagnosed if it is hoarseness, if it is inaudible, if it is fatigue, if it is child voice, if it is a female voice, it is a double voice, it is not a strong voice, it is a high pitch voice, hoarseness, breathy voice. We are bringing it in terms of puberphonia and treating it, provided the structure is completely normal. Try to understand. Your vocal cords are normal, but still you are having a hoarse voice. Your vocal cords are normal, still you are having a nasal voice. If all the structure is normal, then you put it on puberphonia and we do the humor therapy and get success. So those boys, those adults who are having a voice, inaudible, vocal fatigue, child voice, female voice, double voice, nasal voice, not a strong voice, high pitch voice, hoarseness, breathy voice, all can be treated by humor therapy provided their structure should be normal. There is no disease in the phonatory apparatus. You have to confirm it and treat it. We are getting the success. That is why we are getting so much of cases and we are able to give a reasonably with our knowledge good result. So I thank all the people who are listening this small lecture. And next Saturday, once again, we will meet. Thanking you, giving the great opportunity for us in treating so much of cases. Next week, when I talk to you, I think we'll able to cover 1,700 cases of puberphonia. Thank you. Great. Happy, happy, happy.